Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. With me today, as he has been joining us for going on week 2, is Dr. Michael Fine, former Director of Health for the state of Rhode Island. Dr. Fine, thank you for joining us in studio and properly distanced away.
It's nice to be here, Josh.
A lot of things going on. Let's start with the numbers. What are we seeing, both from the total numbers and the trends?
Well, the good news, I always like to start with the good news. Internationally, almost 83,000 people have had coronavirus and have recovered. Total cases internationally that we've measured is 205,642. New cases in the last 24 hours as of 10 a.m. this morning, 16,482, which is up about 10% in terms of the rate of rise from yesterday. In the United States, we now have 6,302 cases and 1,234 new cases. The new cases in the United States have been basically flat, which is really good news. We'll see if that trend is continued, but that suggests that all the work people are doing to try to distance themselves, be cautious, it suggests that that might be actually working. In Rhode Island, we're up to 23 cases, but that's also a relatively controllable rate of rise. We're doing a great job around the state and in every community.
There's a little worry, obviously, in some hot spots. New York City's Mayor de Blasio is saying they may lock down the city of New York, almost an unfathomable idea. 8 million people being locked down. They are stacked up in every building, in every nook and corner. San Francisco is now in lockdown. The Canadian-US border was closed just a little while ago. And I believe France went to lockdown today, pushing the total number of people globally around 160, 170 million. We've talked about this in the past. Are we headed for lockdown in Rhode Island?
Well, I think it depends on what our numbers show. I mean, I don't want to second guess the Department of Health or the governor, but I'd be looking at our daily numbers and looking at our rate of rise. Understanding that we're limited somewhat by the testing. We still haven't gotten online with very robust testing. There's a certain amount that's happening at the Department of Health, but to my knowledge, the other testing sites aren't opened yet. They've been constrained a little bit because of the availability of these little swabs that are used to collect specimens.
So let me ask you a question. If you know you're not testing enough, and you know that you might have to go to a lockdown situation later, wouldn't the prudent thing to do is to go lockdown now?
You know, I think you can do it either way. I think we did a good job closing schools when we did. Locking down now will, in fact, prevent the rate of rise, or that's what we believe. So there is great advantage of doing that, but there is also social cost. And, that's the governor's job, right, to sort out how to balance that.
Probably in about 20 minutes, the governor's scheduled to have a press conference. It's scheduled for 12. She's never on time. So somewhere around 12:20, 12:30. And there's an expectation, there's an announcement on schools. Schools are supposed to restart on Monday. Obviously, they are not restarting on Monday. The state of Kansas has already announced they're done for the year. California is in that same decision-making matrix. From a purposes of allowing people to plan, both teachers as well as parents, and also set the expectations for the children, should we be, again, moving up the decision-making on that? If there's really not a likelihood that we're going to go back, we're not going to go back May 17th for 3 weeks of school, isn't it time to start laying out some of those things? And also, a big push to online learning. This is an opportunity to innovate.
Well, my understanding is that this week is being used to plan for that
Correct.
Online learning and make sure things are set up to get there. In terms of expectation management, I've always been clear that I think this is not done until at least the end of April and maybe into June or July, just based on the rate of rise. Again, I think that's a policy decision at the end of the day. But I think what you're going to see from an expectation management perspective is people will gradually start to own that this is going to go on. It's not a week, it's not 2 weeks. First it'll be a month, then it might be 2 months.
Right.
We may get there in dribs and drabs, but I think people are beginning to understand that this isn't done tomorrow.
Let's have a conversation about the relationship that Rhode Islanders are soon going to have with their physician. That's going to be very, very different. Like online learning, you've talked about in the past. I think you've got some thoughts about this needs to be a FaceTime, a Skype, a phone conversation about getting that initial medical treatment.
Practices are changing right now, have changed this week, and will probably be mostly switched over by next week. To set up to do most of what they used to do in person over the telephone. And our hope and expectation is now that people won't come to the doctor, but they'll call the doctor. And they may get the doctor on the phone right away, or they may get scheduled for a telephone appointment. That's a good thing, because we can do much of what we used to do in person over the phone or over something like Skype. Over video.
Right.
I think you're going to see the bulk of medical care go there. The important thing is that people call first.
Right.
Call first before they go to the doctor, really call first before they go to the emergency department, and call first before they go to an urgent care. This is where it's important for people to have their own primary care physician, because you want to have somebody you can call
Right.
who's responsible for you to pick up the phone. It is also the case that likely only about 50% of Rhode Islanders actually have a primary care physician. And that's going to put some pressure on those guys, because we're not going to be adding people right at this moment. And I'm beginning to do I'm having some conversations with payers, because some insurers have arranged for telehealth options. So I want to make sure that we know what those are and help people know what those are and how to use them if they have insurance but no primary care doctor. That's a fairly large group. And then there's also a smaller group with no insurance and no primary care doctor. And I think a number of us are having some conversations about how to get them the telephone support they need, so they don't feel like they need to walk to the emergency room, for a cough or a cold or a sore throat. Those are the people we want to stay home and pick up the telephone.
The healthcare industry has always been terrible at the adoption of technology. Hospitals, physicians' offices, physicians on email, old equipment. How quickly can they adapt? That office manager who runs that place like a concentration camp head has to absolutely transform almost instantaneously and learn a whole bunch of new skills.
It's a real challenge. It's a challenge because people aren't always prepared for it. It's a real challenge because how physicians get paid isn't prepared for
And
it.
is HIPAA also that overriding? Now, the president did announce yesterday that there was going to be a major relaxation in HIPAA requirements under the National Executive Emergency Powers to be able to allow the healthcare industry to be able to deal with this emergency situation and not be constantly constrained about having the worry of HIPAA violations.
Well, the relaxation of HIPAA will make transactions easier.
Correct.
But for most of us, HIPAA isn't a major problem. Our approach is to be able to talk to the people we take care of, and that's just not a huge issue here. The real challenge is first getting people to be able to and get comfortable with seeing their doctor, over video or by phone, and second, finding a way to support practices financially doing that. We're just not used to doing that, and just like every other business in the state is under stress right now, practices are under stress, but we need those practices to stay open and to stay available to patients, so that when people have a problem, they have someone they can call instead of rushing to the urgent care or to the ED. because those places are going to get overwhelmed.
How serious is the shortage of equipment, safety equipment to protect frontline, emergency room and physicians, EMTs, nurses, et cetera?
I just don't have a measure of that. I know that the Department of Health is doing everything it can to release what supplies they have. We'll see what happens over time.
How do we not have more?
Well, I think we've not thought of ourselves as needing a big surge capacity. If you think about it, we have only as many hospital beds as we need. We probably have more hospital beds than we need most of the time. We have only a certain amount of ICU beds, and that's dictated by daily volume.
Right.
And we're now looking at a situation where volume in the intensive care unit for sure, and in emergency departments may double or triple. And what we haven't done is really plan for surge capacity. So I've actually been thinking in the last couple of days that maybe what we should be doing every time we build a new hotel is providing some public money so each hotel room gets set up with oxygen and other suction equipment so that in case of an emergency, we turn hotels into hospitals. This right-sizing process is tricky.
Right.
If we had adequate primary care physicians, if we had adequate primary care supply for the state, there's reason for thinking that we have twice as many hospital beds as we need on a regular basis, and that comes with a huge amount of cost. But we never want to shrink those beds because of situations like this. We just need to think outside of the box in terms of our health facility and sort of design a just-in-time system that has the surge capacity that we need.
The governor, I believe, is going to speak to school calendar. How important is that message to get out? You've raised the issue about nutrition and feeding children in the state of Rhode Island, certainly in lower-income urban areas, lower-income rural areas in Rhode Island as well. Sure. That's a critical component of the school's role of just basic nutrition to be able to keep kids going. How are we going to adapt to that as well? Are we going to do pick up and go or for the next?
I can't speak to the plans, but I would imagine that we will need either pick up and go, an expansion of the old food stamp program.
Right.
But even food stamps, just provide a way to pay for it. It doesn't provide a distribution system.
Right.
So I think this is a moment when we get a minute to breathe, we're going to need to figure out how we're going to approach all that.
I want to thank you for coming in, and as always, this has been very helpful, and the feedback has been tremendous on these daily segments. We're going to skip out now. The governor's going to be going live shortly. We'll continue the coverage, just a few updates, even since this morning's e-blast at about 7:30, 8 o'clock this morning. The stock market is down about 5-6%. The rise yesterday has been given right back. Secondly, borders of the United States and Canada are being closed. I believe France is going to a lockdown, and the president is scheduled for a press conference either right now or in a little while as well. So this is a very fluid developing national emergency. Our condolences to everyone who's had to file for unemployment, and TDI is a serious economic problem for many Rhode Islanders. I will say this, we took on the greatest empire back in the day and burned down the Gaspee. Rhode Islanders are feisty. We'll fight our way through this one as well. Thanks, everybody. We'll be switching over to the governor's press conference shortly.
Thanks, Josh.